Imagine sitting down and having dinner with your friends on a Friday night like you have dozens of times before. You are having a great time and are telling a story about something that happened to you at work when you are forced to stop mid-sentence. Suddenly, you drop your fork and you put your hands on your head because there's a sharp, searing pain in the right side of your face that came out of nowhere. Your friends start to worry and ask if you're okay, and you begin to open your mouth to tell them that you're fine, but every time you open your mouth, the pain only intensifies. After 30 seconds or so, the pain goes away and you start to relax and tell your friends that nothing's wrong, but this isn't the first time that this has happened. More and more frequently, you've had these intense episodes of sharp pain, but you've tried to ignore them. Finally, you decide to go to the doctor, and after answering many questions and having an MRI done, she diagnoses you with trigeminal neuralgia.
Wait! What is trigeminal neuralgia?
So what is trigeminal neuralgia and how does this happen? 12 out of 100,000 people every year are diagnosed with this condition, also known as tic-douloureux. This is a chronic pain condition that mostly affects women over the age of 50 and involves the trigeminal nerve that carries sensation from your face to your brain.
Does that mean I'm special?
Of course it does. This condition is usually caused by contact between the trigeminal nerve and a blood vessel that puts pressure on the nerve and causes it to malfunction. Usually, what exactly causes this contact is unclear and is just attributed to aging. This condition is also often associated with other primary conditions that damage the myelin sheath protecting certain nerves, such as multiple sclerosis. Injury to the trigeminal nerve can also be a result of sinus surgery, oral surgery, facial trauma, or stroke. Rarely, trigeminal neuralgia is caused by a brain tumor pressing on the trigeminal nerve. Rarely. This pressure on the nerve causes it to malfunction and makes it extremely sensitive. Even the simplest of tasks can cause extreme pain that lasts anywhere from a few seconds to 2 minutes. Some of the triggers of this intense pain include smiling, talking, putting on makeup, a gentle breeze, brushing your teeth, eating, drinking, stroking your face, washing your face, or shaving. The pain that a person experiences ranges from a severe short stabbing pain to a constant aching and burning sensation. This pain may be very localized to only one specific point on the face, which is the most common manifestation of the pain, or it can be widespread. Over time, the intensity of the pain and its duration worsens. The pain-free intervals usually disappear and medication ceases to be effective. This disease is not fatal, but the effects that it can have on a person's life are debilitating. People with trigeminal neuralgia usually end up avoiding daily activities such as communicating and leaving the house, in fear of having another attack. Living with trigeminal neuralgia can be very depressing and frustrating, especially since there is not much effective treatment available for this condition. Some of the medications used in treating trigeminal neuralgia include anticonvulsants. Not always effective, anticonvulsants are used to block nerve firing. Tricyclic antidepressants are also prescribed in order to treat pain. Common pain relievers such as opioids and analgesics are not used in treating the pain because they are usually not effective in this case. If medication continues to prove to be ineffective and/or produce intolerable side effects, the next course of treatment is to look into surgery. There are several types of neurosurgical treatments available to treat trigeminal neuralgia, including a rhizotomy, also known as a rhizolysis. This procedure involves damaging nerve fibers in order to block pain. This procedure always results in some sort of sensory loss and facial numbness. The types of rhizotomies available for people with trigeminal neuralgia include balloon compression, glycerol injection, radiofrequency thermal lesioning, stereotactic radiosurgery, and microvascular decompression. Trigeminal neuralgia affects 1.7 million Americans and has been described as one of the most painful conditions known to humankind. If you or someone you know might suffer from this condition, please don't hesitate to seek help or a local support group. There is always hope for a brighter tomorrow.